the Kolebu dialysis unit has been closed for the past 13 days, forcing patients in need of urgent care to seek treatment at expensive private facilities, while those unable to afford such care are left without options. Bafwa Hinkra is president of the Kidney Patient Association, and he informed Joe News that the closure is reportedly due to a shortage of consumables. He's urging hospital authorities to provide clear communication on when the facility will reopen. So he joins me in studio for a chat here. Grateful to you for joining. Yeah. Why are you making such a call that it's because of consumables? What do you know?
There's not been any official communication telling us what exactly the problem, why the unit has been closed, or the unit is not functioning. And exactly last year, the same thing happened, and we were told it's consumables. And we are in the same thing this year too. So we presume that, like it's a rumor that the consumables are not there, because the machines are sitting down there. You go, you see nurses around, doctors around, but they are not working. So what is going on? And nobody has even invited us, tell us that maybe we are having this challenge or we are having this, that is why maybe the unit is not operating. Nobody is telling us. 2 weeks. Sunday coming will be exactly 2 weeks.
So that happens, what do? You go to private?
You have to go to private facility, and it's very expensive. Even Kolebu, that, let me say the government facility that is even cheaper, is 491 per session. You need to do 2 or 3 times a week. So that is the cheapest you get. The private ones are charging between 600, 680, 700, 900. Even some are even charging 1,000 per session. And so if you're supposed to do that twice or 2 times a week, where will you get the money from? And it's a big challenge. When it happens like that, people just stay in their house waiting for whatever will happen to them should happen to them, which is not good. Communicate with us. Tell us something. That we are having this challenge. So that is why the unit is on break or something of that sort. Nobody, it's like nobody cares about us.
Okay.
We are Ghanaians. We pay tax. The dialysis is not for free. We pay.
So what has been the impact, apart from finance? When you go to the private hospital, how much do you pay?
It depends on where you are going to. I mean, like I'm saying, the lowest you can get is about 600.
600. So what has been the impact, not finance, but when you take away finance, what has been the impact of this on your members?
No, health-wise, they are looking very weak. You need to clear the system, the toxin from your system to be a bit healthier. They are getting weak. You see some of them, their pot bellies are coming. They know that they have pot bellies, but because their system, the things in their system, they are getting pot belly. Their legs are being swollen, puffy faces. And sometimes this thing normally leads to death.
Wow, interesting. But you reach out to Kolebu and nobody's...
They are not even getting anybody to talk to you. We don't need to get to Kolebu. We don't need to go to anybody to go and ask what is happening. You people are managing the place. There is a problem. Just invite us. We are having this challenge. So that is why maybe we are shutting down for a number of these days or something so that we put things in place that you come back. Simple communicate. And nobody, whom will you get? When you go there, whom will you get to talk to?
No. So I mean, I'm asking this because for 2 weeks, you've not had the authorities to even tell you that it's ABCD, the reasons why we are shut down.
Nothing. If, by God willing, we are not dead, and we enter next week, we don't hear anything, we are going to pick it at the place. We'll carry our mattresses, everything, and go and sleep at the mosquitoes. We'll sleep there for them to see how serious the whole thing is. Tell us something. Yes.
Next week.
If by next week we don't hear anything from them, that this is the situation, we are human beings, we are not dumb. So maybe when you tell us, at least we should reason up with you. If we don't hear anything from them, by next week, we will start picketing at the place.
And when exactly next week?
We are giving them by close of next week, by Friday, by this time. If you
don't hear anything,
yes.
It means that Saturday you picket.
Saturday we cannot picket. We'll start from Monday or
Friday. The following Monday.
We'll picket there. We'll go with our mattresses, go with everything that we need. We will go and sleep there. We'll hear something or the unit is reopened. What is going on? People's lives are in danger. I can tell you that since the 2 weeks, I think about 2 or 3 people are dead.
Oh, how many?
2, I think two or
Since
3.
last week,
Yes,
you
since
can
2
say
since,
that 2
Yeah.
to 3 people are
Yes.
dead
Yes.
because of that.
That one, I'm not a medical doctor,
So you
so I
cannot
cannot
answer to it.
get. But the point is, I believe if the unit was running and we're having our regular dialysis session, maybe a doctor or a nurse could have seen something and advised. Because
that
now
didn't
we are on our own. Maybe unless you force yourself, you go and see a doctor. Because like almost every day, you are supposed to visit the unit 2 times. So you definitely see a doctor or somebody there to assist you or something. I mean, why?
Wow. This is quite serious for you people. But you were on a board that was dealing with the financing issue about, so there could be some relief for you. What has happened to it?
Yes, we agreed on some of formalities or something to go by, because the government said it wanted to do something for us 6 months, that is starting from June to December.
Yes.
So we sat down, we did the actuals, and we came to a conclusion that those above 60 will get all their A-session freeze. Children below 18 will get their A-session freeze. We in the middle will be getting 2 sessions per a month. That is, out of the 8, we get 2.
Yeah.
So that was
paid for you by government.
Pay for us by government.
Okay.
That was what we agreed. But Kolebu, since we started from June, it was just last 2 weeks they started. So from June, the inception of the program, Kolebu have not done it.
You were paying.
We were
Also,
paying.
You were
We were paying. But we were made to understand that there will be refund
Okay.
for us. But I don't know anybody who has gone for refund who has got it. But for now, Kolebu said they've started. But starting it, the unit is not working. So when you are going out, you go and pay because they don't know anything about national health insurance. If it is Kolebu, maybe you can enjoy that program. But now Kolebu is not working for 2 weeks. So as they've started, we don't know what is happening.
So did anybody benefit before the shutdown came?
Yes, I think the old age.
They did.
They had, I think, 2 or 3 days sessions before the thing went shut down.
Okay. This is quite serious. And you've been on a board that was helping government to arrive at a conclusion to do that. Imagine you were on a board and the president was part around that table, and you had to let the president understand your issues. What would you tell him now? Imagine the president is sitting around the table with you now, and he's listening to you. You look into his eyes and address him.
My brother, the only thing I'll tell the president, no one can sustain dialysis treatment.
So I want you to look into the camera as though the president is watching you in the face and tell him.
Mr. President, no one can sustain dialysis treatment or fund it. So it's high time the government look at it critically if they will take fully cost of it so that they can put on the national health insurance fully. So at least those living on end-stage kidney failure can also have some respite in life. Because even if whatever money that you have, once you go on dialysis and you don't go for transplant, your money will get finished. And sometimes the money will get finished whilst you are still alive and you'll be struggling. So we beg them, they should look at it critically, holistically, because on the board, we had certain things in place, but for now, I think everything's on hold. I think we are getting election year, so maybe when we come back, whoever comes back, we'll take it up from there. It will be very good for us. And then they should take the taxes off the consumables so that the private sectors can also let their prices come down a little bit for us. If the taxes are waived off the consumables, those in the private sector can bring their prices down, which it can be a little bit affordable to us.
So
that's
the
what I would like
taxes
to tell you. Yeah, the taxes
should be off.
should be off on the consumables. Or medical appliances, they should take the taxes off. Because just BP medication, that's a time, BP medication, they will tell you it's because of the dollar. We are buying BP medication, we used to buy it like 5 cedis, 6 cedis. Now you go, it's 20 cedis. Not even a strip, or maybe just a strip. Maybe you need 1 box for a month. So you can just imagine. Everything keep going now. So apart from the dialysis itself, you are buying your BP medication. We have an injection that we take, erythropoietin. We call it IPO. We are paying for that one too. We are supposed to be on special diet. It's not anything that you can eat. That one too is another money. Wherever you are staying, coming to Kolebu, transportation, sometimes you cannot join Trotro. When you finish, you are so weak, you are tired. You need to get maybe a comfortable car sitting in and go home. You need boat or Uber. Expensive. So everything around it is very expensive. So government should look at it once again. We beg them. It can happen to anybody. We have big men who are on dialysis. You can't mention names. We know them. They know us. If they speak and then big men will hear, they should speak to them and they should look at it. I believe we can do it. I have a strong belief the government can do it. As they're able to do the free SHS, they can do it. So they should look at it for us.
Zayinkra, all the best to you and your other members. This was quite a troubling time for, kidney patient, but our hearts are with you wherever you will be. This is still the